Welcome to this series of conversations by Viridian Nutrition on the topic of post-COVID-19 syndrome, which is also referred to as long COVID. In these sessions, we're absolutely thrilled to be talking to Dr Tamsin Lewis. Dr Tamsin Lewis is a qualified doctor. She's also a functional medicine practitioner and a former triathlete. Now, Dr Tam contracted COVID-19 in March 2020 and went on to develop long COVID. In fact, she is still experiencing symptoms now, nearly 12 months on from the initial infection. Welcome, Dr Tam. We're so pleased that you can be here with us today. I wonder if you could tell us a little bit about your situation in terms of contracting COVID-19 infection and it then extending into long COVID.
Hi, yeah, sure. I don't want to bring too much doom and gloom because there's a lot of it around at the moment. So hope to spin a bit of positivity in this. But I contracted COVID-19 probably at the start of March. In the first few weeks, we didn't know a lot about it then. And certainly even me as a medical doctor, I couldn't get a test because we weren't doing tests then unless you were admitted to hospital. So it was a bit of a difficult time. My first symptoms were gastrointestinal, actually. My stomach sort of blew up and then I had gastric symptoms, which was a bit, not what we knew at that point. Was associated with COVID, but then over the next few days I had a high fever. It was recorded on my Aura ring, which is really interesting. It kept flagging up at me. I was like a high temperature, high heart rate, all of the early signs of fever. So it kind of progressed over a week, and then at day 7 to 8 I developed what we now know to be the cytokine storm, which is where your immune system it basically goes in overdrive in response to exposure to this virus. Now, I should preempt this by saying I now know that I had a high viral exposure and therefore a high viral load. My 5-year-old actually had the virus. We subsequently tested her antibodies and she was mildly affected. She did have a high fever and a cough for a few days, but she kissed me on the lips and coughed directly down into my lungs. And when you have a feeling that something's not going to go well from that. So yeah, I was disseminated with quite a lot of virus up front, and I think my immune system went into overdrive, and that caused a lot of what we know with the very deep muscle aches, pains, joint swelling, rashes. All of that is due to an overactive immune response because the body sees the virus a bit too late and then goes, right, we need to drop some bombs on it. And I'm sure we'll come to that. But, my experience since has been, it's still with me, this kind of concept of long COVID. I remember getting on social media after 2.5 weeks thinking, why have I still got symptoms of, that we think was COVID? I did actually get a test 3 weeks later privately, and that was positive still after 3 weeks onset of symptoms. Now, whether that means I was still infectious, we don't know. I was in isolation anyway, but I was definitely still symptomatic with ongoing respiratory symptoms. Now, a lot of people don't get those respiratory symptoms. I did, actually. I developed double pneumonia, which was subsequently diagnosed after them not being seen on chest x-rays. COVID is very good in the lungs at avoiding detection. So it took CT scan not until June, which is when I could have it privately, that showed I had pneumonitis, widespread inflammation in my lungs. And yeah, so the symptoms have still been ongoing, but month on month there's improvement. I have, like many long COVIDers, I have poor exercise tolerance, which is devastating for me, given I'm a former athlete and I basically can't do much more than walk and yoga, a bit of light cycling, because if I do, and like many others like me, it sets you back. You get this sort of heightened inflammatory response again, and you feel very, very wiped out. And we'll come to talk about inflammation. Yeah, so I think the more we research long COVID and COVID itself, the more we're becoming aware of these sort of who's at risk of developing, not just dying from the disease, but also developing these long syndromes. And myself, I have I have some of the inflammatory genes.
Okay.
So, and I'm prone to this histamine reaction, which has definitely worsened a lot of the symptoms.
I think that leads quite nicely into talk a little bit more about inflammation. If somebody was looking to spot whether they've got this heightened inflammatory response, what exactly would they be experiencing?
That cytokine storm that I talked about, which are cytokines are inflammatory mediators that are released by the immune system. Now, we can't measure them really outside a research environment. It's quite a complex, expensive blood test looking at TNF alpha and interleukins, but it reflects itself in very deep joint and muscle aches. So for me, it was around my hips and my lower back, and a lot of people the same. It felt the worst pain since childbirth. It was very extraordinary. And it's sort of like this, the joints feeling a bit more hot and swollen. So what I did wrong is start to exercise too soon. And that would have, with any impact, that would have triggered inflammation. So really, we now know that rest is absolutely essential with COVID, specifically if you have respiratory symptoms. So you will feel it as deep muscle aches and pains. Some people have this tinnitus, which is potentially a sign of neural inflammation. I certainly had that. It was quite disruptive at times. Also the gut inflammation, and we'll come to how you can improve these things, can be seen in, gastrointestinal upset, diarrhea, stomach ache, poor nausea, poor tolerance to foods that you could previously tolerate. So those are some of the symptoms. But yeah, rashes. You've probably seen on media about COVID tongue and COVID toe, and all of these are just inflammatory reactions. So inflammation can take seat in any different area of your body. But if you do get those very deep muscle aches and pains, and you have respiratory symptoms, I would very much be talking to your healthcare provider.
Thank you. That was really enlightening. So in terms of supporting those types of symptoms and working towards recovery, do you have any tips in terms of nutritional support?
Yeah, I should state now, before we go into the nutrition, that if you do have that cytokine storm and you are particularly at high risk, for example, if you've got diabetes, high blood pressure, if you're obese, then you really need to be getting medical treatment in the form of steroids. You've probably seen that in the press that steroids are one of the things can modify the course of the disease. So I have been told that if I had got steroid treatment when I was having that cytokine storm, that potentially things wouldn't have been so bad, because it suppresses those cytokines, which is causing all the collateral damage. So in terms of nutritional support, you have to really tackle it in multiple directions. And the things that we know can help are a few things. N-acetylcysteine is an amino acid that is involved in the antioxidant defense system in the body, and it can convert down to glutathione, which is depleted massively when there's infection. So I've been recommending from the start N-acetylcysteine in fairly high doses. I take 3 of that N-acetylcysteine that I think that works out to about 2,000 milligrams. It's not insignificant. So that's one. I also used oregano oil as more for its antimicrobial action, but alongside when thinking about your lung health. And then curcumin, as we know, the active ingredient in turmeric, is very good for modifying inflammatory pathways. I never know how well, or otherwise I would have been without these supplements. But I was taking so much turmeric, my palms, they still are actually yellow.
Get a tint. Yeah.
So I was very much tainted with turmeric. But we know now, you can make it into a paste. I found it very helpful to use the comfrey balm on the joints, because that can help stem inflammation. Omega-3s, super important, because they help modify some of the inflammatory pathways. But we are talking significant doses here. We're not talking popping one a day. You're talking like 4, 5, 6 of these in the acute phases to really help dampen down that inflammation. What else did I use? Actually uses something a bit more off-piste, the ketone ester, which is what we call exogenous ketone. It's a fatty acid that can modify inflammation, and they are very expensive and difficult to get hold of, but they very, very much helped. I created at Oxford University. So those are the main things. And then drinking, having broths that contain glutamine, very good for the helping the any gut inflammation. Collagen is very good for dampening down inflammation too. So you have to throw, if you're one of those people that's prone to being at risk, you've really got to throw everything at this.
And it's probably useful at this point because, you were talking very much about the amount to get a therapeutic response that you were having to use was probably much more than, manufacturers' guidelines, for example. So this is probably the prime point to be looking at nutritional therapy and using a medical practitioner and taking their advice, isn't it?
Absolutely. I mean, there's been so much advice bandied around on the internet about how vitamin D, zinc and C can kill COVID, and that's not how it works. It's your immune system in a appropriate manner that's going to contain the virus and prevent the collateral damage. It's so I think you really have to get advice because your symptoms might not be the same as someone else. And vitamin D, for example, it depends on your levels. We all can't be taking 10,000 units a day. Some people are going to be much more deficient in vitamin D than others. But I'd really be looking at working with someone. And specifically now we know that gut health is so important in determining who gets affected by COVID and developing long COVID. So this whole concept of dysbiosis, the imbalance of the good and bad in the gut, is really something I would urge people to look at, to get tested, to get some nutritional advice. And that was my own experience as well, having had gut problems for a number of years due to my background in endurance sports, stress, all of the things that we all are, exposed to.
Thank you for that insight. That was really interesting. I wondered if you could tell us, which intervention do you feel has been the most positive for you?
I would say that what's helped me the most, I think you have to be very careful pacing your exercise. Don't do any intensity of exercise that's going to give you impact on your joints. I would be looking at whether you have mast cell activation syndrome or excess histamine, because that, like me, responds very well to a lower histamine diet, but also the addition of specific antihistamines. And I personally am on prescription antihistamines now. I would be saying magnesium salt baths that really restore the nervous system, trying to do some breath work, anything that activates parasympathetic, high doses of fish oil, curcumin on everything, or as I said, high doses of a supplement, bone broth, and to consider whether you're deficient in vitamin D and the other major vitamins.
Okay. Well, there's a whole load of information there for people to take away and absorb. So thank you very much for your time and this discussion today on inflammation.